Right, so for the last part of our vertebral column, we'll now have the sacrum, which is this one, then the coccyx, which is this one. Right. For description purposes, sacrum is made up of 5 fused vertebrae. The coccyx is made up of 4 fused vertebrae. And if you look at them together, the shape there, they are both wedge shaped. But the wedge is in such a way that the wider part is above. So the base is above, then the narrow part is where it is below, both for the sacrum and the coccyx. Right. So they are both wedge shaped, and the wider part or the base lies above, and the apex is directed downward. And when we do the pelvis, we're going to say that the sacrum actually forms the posterior part of the bony pelvis, which will be completed by the ilium, the pubis, and the ischium. Right. So in an anatomical position, like where someone is standing in an anatomical position, the sacrum has a particular position. It's not going to be arranged in this way. The arrangement is in such a way that this surface that we are seeing here, this anterior surface here, it's going to be directed in a particular manner. So we call it the pelvic surface because it's in contact with pelvic viscera. The posterior part will have its own orientation. Right. So this anterior part or this pelvic surface faces downward and forwards. So it faces downward and forward in an anatomical position. Right. And remember I said L5 and S1, there is normally an angle between L5 and S1, which we call the lumbosacral angle. So there's a lumbosacral angle between L5 and S1, which is usually about 210 degrees. Right. So it's called a lumbosacral angle. Right. So to describe in this region here, this is where we have the base, right? Where we have S1. Right. Then there's a unique feature on S1, which is a projection going forward, which we call the sacral promontory. This sacral promontory, it's more indented or it projects more in males, such that when we then do the pelvic inlet in pelvis anatomy, you're going to find that the inlet for the males, it's going to be android or heart, whichever word you want, heart-shaped, compared to the female one, which is almost oval, because this sacral promontory will be almost flat in a female, right? Then this upper part of S1, it articulates with L5. And remember, all the other vertebrae were having a vertebral canal. So in the case for the sacrum, there is a sacral canal there. Right. Just that we don't have the spinal cord here because spinal cord ends at the level of intervertebral disc L1, L2. So you don't expect to see the spinal cord in this region. Right. You're also going to have pedicles. I'm not going to be able to really show you these things because they will be almost degenerated. So I think this is a good picture. That's the promontory there. You can see it projecting forward. There's also going to be spinous processes. But you still have the pedicles and the what, but there's something more to it. Right. So we say there's a sacral canal. There's this ala as well. They look like wings of a bird. When you do pelvis, you're going to talk about things called a clinical called Robert's pelvis, Nigel's pelvis, and the likes, where this ala will be absent and the pelvis tilts to one side. So these are the flaring parts of your S1 vertebra. Then pedicles for your sacral vertebra, they are not as long as the other pedicles, so they're going to be quite short and they go backward and laterally. Right? Can't really show on this kind of pictures, but just know that the pedicles, they are directed backward and laterally for the sacrum. Right? Then these are the spines. Let me see if I can. These are the spines for your sacral vertebra, but there is this opening here, which we call the sacral hiatus. So remember, for me to form a spine, the two lamina should meet posteriorly. But in some instances, the two lamina for S5, they fail to fuse and they leave an opening there, which we call the sacral hiatus. And rarely S4 is also involved. So sacral hiatus is where there's failure of fusion of the lamina of S4, resulting in that gap there. It can be S4 or S5, but more commonly S5. Right. Okay. Then I showed you this ala. So if you remember the structure of C1, cervical vertebra number 1, remember it had lateral masses. So these ala resemble those lateral masses. Right. Then what else would I want you to see here? Can you appreciate these openings here? Both on the anterior surface or the pelvic surface of the sacrum and also on the posterior aspect. These openings are what we call sacral foramina. So these here are the anterior sacral foramina, which I see from the front. Then these are the posterior sacral foramina, which I see from the back. Right. So those are sacral foramina. They allow for passage of the anterior and posterior sacral nerves. Right. Then what else would I want you to know? I would also want you to know the contents of this sacral canal. So sacrum and coccyx, there's really more to this. There's a really lengthy description. We can spend an hour talking about the sacrum and the coccyx, but most of those things are useless. Because basically its function is weight bearing as well. Right? So within your sacral canal, we also have things there. So there are contents within the sacral canal, and those include the corda equina, right? Those nerves that are leaving the lowest part of the spinal cord, the conus medullaris. Right? We also have meninges of the spinal cord. Though the spinal cord ends at intervertebral disc L1, L2, the meninges that surround your spinal cord, they end at S2. By meninges, in this case, I'm referring to the dura mater and the arachnoid mater. The reason why I left out pia mater is the other content of the sacral canal is a continuation of pia mater. Pia mater ends where the spinal cord ends, and it continues as a purplish phylum terminal, which comes to attach on the coccyx. So the phylum terminal is also going to be a content of your sacral canal. And then clinically, you can talk about lumbarization and sacralization. It's something that I described when we're doing the lumbar vertebra. Then on this pelvic surface, we are going to see this pelvic surface forming the posterior wall of the pelvis. And there's going to be a muscle there called the piriformis, something that we'll do with pelvis anatomy. So I won't go much on it because you won't know if you haven't done it. Right? Okay. Then, do you think there's a difference between the male and the female sacrum?
I think there is.
There is, right? Is there any difference that you can think about
Yeah.
right now?
I think mainly it would be how, the shape. I don't know how I can best explain it. The shape, I think that's the only difference.
There's a lot. But
Okay.
for males, it's longer and it's narrower. Females, it's short but wide. The same thing that you use when you describe the clavicles, when you do your upper limb. Right. Then the concavity of the sacrum. Can you see this concavity here? Right. So this concavity for females, it's a bit deeper. And then the concavity for males is a bit shallower. Remember I said this is forming a wall of the pelvis. For females, there's a uterus. You want to have a baby there, right? So the female pelvis has to be roomier. There has to be more room in the female pelvis. Hence the concavity there to increase room in your pelvis, right? Then this is the coccyx, which we call the tailbone. It consists of 4 fused rudimentary bones, as opposed to the sacrum, which consists of 5 fused bones. So that's your tailbone. It's the human tail. It's triangular in shape, or you can say it's wedge shaped, the base being superior, the apex is below. Right. And it's named coccyx because it resembles the beak of a bird. So there's a Greek bird, I'm forgetting the name, from which this derives its name from. Right. Okay. And that's your human tail. Right. Okay. Then superiorly, it articulates with the sacrum. Inferiorly, it articulates with nothing. Right. Then, is there anything you guys were told about this this coccyx which you would want me to describe in particular? Or what's written on your
Not really.
or anything that's written
No,
on
there's
your
nothing much.
or anything that's written on your schedule? Because
Causal
there's
sign.
because there's really nothing that's important to describe about it.
Yeah. Yeah, I think there wasn't anything else there. Just a quick question. They say there's there are 4, there's false and true pelvic, something like that.
False and true what?
There's some false and true.
True pelvis.
The pelvic. What's that? I tried to look at it.
Okay. That's we'll now be describing the hip bone more, but it's fine. Let me get a picture for you.
Okay. Because the hip bone is there and it's dominant in the notes and the course outline.
Are you supposed to do hip bone with the back?
Okay, from what I'm seeing here, there's a hip bone from the front only. I think so.
No, I mean, are you
Yeah.
supposed to do
Because it's
the hip bone with the back on your schedule? Are you supposed to do a hip bone with the
articulation of
back
hip
or
bone. It's there where the symphysis pubis.
okay? So this is your hip bone, yeah.
Sacroiliac joint.
Okay, that's fine. So this is your hip bone, yeah. This one, the upper part here. Maybe let's use this one first. The upper part here is the ilium. Then the lower part, there is the pubis here anteriorly. Then there's the ischium posteriorly. This picture may be hard, but let's use this one for you to understand better. This is the sacrum and the coccyx that I was describing. This is the rest of the hip bone. This is the ilium. Anteriorly, this is the pubis. At the back there's going to be the ischium. The ilium articulates with the ala of the sacrum to form the sacroiliac joint. Right? And there's a line which I will draw here. This line here, this is the pelvic inlet. Right? Anything above this on this pelvic bone is what we call the false pelvis. Then anything going inside that bony canal, that's the true pelvis. Do you get it? Anything above the pelvic inlet that I put a circle around, that's the false pelvis. Basically, false pelvis will be continuous with the abdomen. Right? When you do abdomen, false pelvis will be continuous with the abdomen, such that the boundaries posteriorly there is the lower lumbar vertebra, because inlet is at S1 level. So if you're saying above, that means we're now going to lumbar vertebra. Right? And what else is written about the hip bone, which you must know?
Okay, I think those are the major things.
Because
the ilium, he was describing the ilium, yeah, because the hip bone is there.
Because it becomes easy to describe the hip bone when you are describing with the pelvis, especially the walls of the pelvis. Because now, if you just describe a hip bone like this and you say there's an iliac fossa, there's an ischial spine, there's an ischial tuberosity, without then describing what's attached there, you are defeating the whole purpose. So you need to describe it with the walls of the pelvis. Then you say on this lateral pelvic wall, there's a muscle called obturator internus, blah, 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 and the likes.
Yeah, the pelvis is there, bony pelvis.
It's supposed to be done this week again, or is it there on
We'll
is
be
it there
writing it next
on
week.
this week, or like the schedule for the other weeks?
Okay, he's changed his mind. Today we were supposed to write, But he said whatever we're going to write this week and what we wrote last week is going to be written next week. So everything that we're doing will be writing next week. The back, the vertebra, the what, everything.
Wait, there's back. Okay, there's vertebra, there's back muscles, there's what again?
Wait, let me just read it out for you, what he wrote. Sorry, give me a second. Oh yeah. Okay, so it says we'll be doing what? Oh, yeah, we'll be doing the back, muscles of the back, okay. You have the course outlined, right?
Yeah, but it's far away.
The it's okay. The pectoral region, pectoral region and the axilla, and then the breast, histology of the breast, anatomy of shoulder and shoulder joint, cubical fossa, and forearm.
Is this hip bone involved?
Yep, it is. It's under crush 1 if you were able to check.
It's fine. Let's talk about it then.
It is. Thanks. Okay.
Okay. So as we're saying, the hip bone is made up of the ilium, the pubis, then the ischium. Then the two hip bones together, they form what we call the pelvic girdle. So the pelvic girdle, just as we are going to have a shoulder girdle, right? So this is the ilium. The ilium will have an iliac fossa. Yeah, that's where there's origin of the iliacus muscle. Then there's a crest here, the highest point of the ilium, something that you can feel on your hip. That's your iliac crest. Iliac crest is from anterior superior iliac spine to posterior superior iliac spine. Since you're calling them anterior superior iliac spine, that means they should be inferior. So there's also anterior inferior iliac spine. There's also going to be posterior inferior iliac spine. There are specific things that are attached there, some of which are muscles of the lower limb. For example, the rectus femoris attaches onto these spines. The muscle on the anterior thigh. Right. Then, what else can I show you on the ilium here? This line here, which I said is at the pelvic inlet, we call it the arcuate line. Right. The whole line, when now extending to the pubis anterior, it's called an iliopectineal line. But just the curved line on the ilium, it's called the arcuate line. Right? And where the two hip bones meet anteriorly, the two pubic bones particularly, where they meet anteriorly, there is a joint called the symphysis pubis, or the pubic symphysis. Right. Then below the pubic symphysis, there's an angle there, which we call the subpubic angle. This subpubic angle, it's wider in females, it's about 80 to 85 degrees in females, versus the male one, which is about 50 to 60 degrees. Right. And the three bones, they are fused. The ilium, the pubis, and the ischium, they are fused after puberty. Before puberty, there are 3 separate bones which meet at this acetabulum. Let me show you from another view. Where is it not being? There's really no clear picture of an acetabulum. Why? But they meet at the acetabulum. Yeah. That's where the pubis, the ischium, and the ilium meet. Ilium makes the superior 2/5, 2/5 of this acetabulum. Ischium makes the posterior inferior 2/5. Then the pubis makes the anterior inferior 1/5. Right. Then I had said this is the pelvic inlet. This one is a male pelvic inlet. You can see that it's heart-shaped here. It's hard because of the indentation of the sacral promontory. It projects more inward. For females, it's flat, which makes it almost oval in shape. Right? And this pelvic inlet separates the false pelvis above from the true pelvis below. Right. Did you guys talk about boundaries of the false pelvis, boundaries or what?
No, I didn't see that.
Okay, let me just open your course outline again. Okay. Okay, it says describe the boundaries of the pelvic inlet and outlet. So this is the pelvic inlet. The boundaries, anteriorly, there is the symphysis pubis. Laterally here, there is this iliopectineal line. Then posteriorly, there is the sacral promontory or S1. So anteriorly, there is the symphysis pubis. Laterally, there is the iliopectineal lines. Then posteriorly, there is the sacral promontory. On the other hand, this is the pelvic outlet. The pelvic outlet, anteriorly, there is the pubic arc. That gap or angle below the symphysis pubis. That's what anterior. Posterior, there is the coccyx. Right. Then laterally, there is the ischial tuberosities, these ones. Right. So there's an inlet, then there's an outlet. The space between the inlet and the outlet, that's the true pelvis. The space above the inlet, that's the false pelvis. Right. Then it also goes on to say, identify the structures forming the pelvic walls. So the pelvis is like a basin. There's a roof, there's a floor, and there's the lateral walls. Then there's a posterior wall and an anterior wall. I always like to start with the anterior wall. The anterior wall is this one. It's the shallowest, it's the smallest. What makes up the anterior wall? There's the symphysis pubis and the pubis. The posterior wall is what we described at first. The sacrum and the coccyx. There is a muscle on the posterior wall, which is called the piriformis. Then the lateral walls, they are the sides there. All I want you to remember about the lateral wall are two things. Number one, there's a muscle as well. The muscle is called obturator internus. Internus means internal, it's inside, such that we are going to see an externus at some point when we do the lower limb. Okay. Number two, below the floor of the pelvis, there's another region called the perineum. So imagine things that are in the pelvis, then they want to gain access to the perineum, yet there is a floor. Those things need to exit the pelvis through a window, then enter the other region through another window. It's like you want to connect to a socket in the next room. You can't go through the wall, but instead you put your cables through the window, then outside through another window, back inside. That's what happens with the pelvis. On the lateral wall, there are two windows. These ones. There's a greater sciatic foramen, and there's a lesser sciatic foramen there. So things exit the pelvis through the greater sciatic foramen there. They go outside. And they go into a region called the gluteal region, basically the buttock region, which is part of the lower limb. Then from that gluteal region, they will enter the perineum through another smaller window, which is lesser sciatic foramen. Right. It would be very, very good if you remember the things that pass through these two foramina. I know greater sciatic foramen is less than 10 things, it has more than 10 things passing through it. So it may be hard to teach that one, but lesser sciatic foramen has 4 things that pass through. And here's how I want you to remember. For posterior pelvic wall, remember I said there's a muscle, the piriformis. So the piriformis will pass through the greater sciatic foramen, right? Then lateral pelvic wall, there's a muscle, which is obturator internus. So this obturator internus passes through the lesser sciatic foramen. So each foramen is a muscle. Piriformis, greater sciatic. Obturator internus, lesser sciatic. Having done that, the other things that pass through the lesser sciatic foramen, they would have passed through the greater sciatic foramen. Because remember, the greater sciatic foramen is the window to go outside, then lesser sciatic is the window to come back inside. So the mnemonic is PIN, P-I-N. There's a P, there's an I, and there's an N. The P, it's called pudendal nerve. Won't make sense now, but it's the nerve of the perineum. The I, it's internal pudendal vessels. That's the artery in the vein. Then the N, it's nerve to obturator internus. The muscle that we said is passing through that lesser sciatic foramen. Right. I think that's describing this bony pelvis in a nutshell, which maybe links it with the back. And there's the sacroiliac joint, which I said is in this region. Yeah. Opposite S1. This sacroiliac joint is a synovial joint with limited movements, as opposed to the synovial joints that you see in the upper limb, which have a great variety of movement. This has limited movement. Right. And in old age, it becomes fibrosed. It becomes a fibrous joint. That's why you then see the stooped posture. Like you see the older generation now using a stick to walk. It's because these joints would have become fibrous. Okay. Any other question on this?
No.
Or
Just have to go
something,
and read.
or something that you feel like I left out about it, which you want to know?
Okay. Okay. What I want to know, there was in the course outline there's a there's a question like it says list the different types of female pelvis. Like how do you explain that? Different
Okay.
types.
So we have 4 basic types of pelvises. There is what we call the gynecoid pelvis. Remember gynecology, obstetrics and gynecology. Yeah. So basically, gynecoid pelvis has to be the female one before you go far. So there's gynecoid, there is android. Android pelvis is typically the male pelvis. I think I've done a video on that. I'll share. And then there's platypeloid. A platypeloid pelvis is 2% of the pelvis is out there. It's not ideal for a vaginal delivery. So you need to do a C-section for that one. So I've given you 3. There's a 4th one. So I've given you gynecoid, platypeloid, I've given you android. The 4th one is anthropoid.
Android. Yeah.
No, like android is the male one. Then anthropoid is more
Always
it's ascribed to the Africans. It's more racist, I think. The reason why there used to be, there's a picture that I know is in this book which I can use to describe. They have different dimensions. I don't think I'll find the picture, but I may not find the picture fine, but they have different dimensions, right? Gynecoid, which is the normal one, which most females have, the inlet is going to be oval, and there's more room in the pelvic cavity, which is suitable for the baby to pass during delivery. The android one, the male one, the inlet is heart-shaped because of this, where is that picture that I once showed you? Because of that sacral promontory, this one. So this will be a type of an android where there is that bulging of the sacral promontory, right? Then the cavity is a bit funnel in shape, and there is no room. There's little room within it for the baby to grow, right? Then platypeloid, on the other hand, this is a pelvis. Remember I said it's not even ideal for delivery. It's very difficult for you to deliver there, right? These pelvises have a larger transverse diameter, so they look like this. The transverse diameter is large compared to the anteroposterior diameter. That's platypeloid pelvis. It's not ideal, right? Then the African one is anthropoid, more in our African females. Don't know why they call it anthropoid, but it is what it is, right? It also poses difficulty in smooth delivery, but there will be delivery. Android for the male one can cause obstructed labor, meaning one that is very, very clean and less likely to have complications of delivery. It's going to be the gynecoid pelvis. I'm not sure if I answered your question.
Perfectly.
Okay. More things. More things you'd want to know.
Everything we've talked about is there in the, so we've addressed every issue I had.
You sure? Okay.
I think so. Yeah, I'm
All
fine.
right. Meaning on your outline, the next thing I should do is where is it? I had opened it. Anatomy of the spinal cord
Yes.
and muscles of the back. Okay, that's fine.
Mhm.
I think I'll do one of those tomorrow.
So,
Then.
what's the difference between the spinal cord and the vertebral cord? Is the spinal cord is what now?
Spinal
The
cord is
nerves.
now the neural tissue. Not really the nerves, but yes, where the nerves will come.
Okay.
It's now
Okay.
the neural tissue. So you'd find that um, I'll probably
Okay.
go down with this.
Mhm.
Where you have, say, C6 vertebra is not where you have C6 for the spinal cord. They're different.
Okay.
Because remember, spinal
Okay.
cord, I said it ends at
Okay.
L1, L2. But where it ends, it would have given you a coccygeal nerve already.
Mhm.
So there's that discrepancy in terms of length. The vertebral column grows because of height adjustments, but spinal cord will not. So where you have a vertebral level is not where you have a spinal cord level. I'll describe that for you when we do the spinal cord and the spinal nerves and the likes. Probably tomorrow.
That's okay.
Okay.